Prometric Q and A and rationals. Psychosocial integrity. 1. Which couple is at greatest risk for domestic violence? A couple which consists of a husband and wife, both of whom are affected with Alzheimer's disease. A poverty-stricken couple without any healthcare resources in the community. A pregnant woman and a husband who was physically abused as a young child. A wealthy couple with feelings that they are immune from punishment and above the law. Answer, C. A pregnant woman and a husband who was physically abused as a young child is the couple is at most risk for domestic violence because pregnancy and a personal prior history of abuse are two commonly occurring risk factors among abused women and male abusers, respectively. Other patient populations at risk of abuse and neglect include female gender, infants, children, the cognitively impaired, the developmentally challenged, the elderly, and those with physical or mental disabilities. Some of the other traits and characteristics associated with abusers include substance-related use and abuse, a psychiatric mental health disorder, poor parenting skills, poor anger management skills, poor self-esteem, poor coping skills, poor impulse control, immaturity, and the presence of a current crisis. 2. You are caring for a client who has been assessed as having a past history of violent and dangerous behaviors towards others. You, as the nurse, are concerned about this client's past history and the dangers that may adversely affect others, including staff, visitors, and other clients on the unit. What is the first thing that you should do to prevent violence towards others? Restrain the client. Place the client in seclusion. Get an order for a sedating medication. Establish trust with the client. Answer, D. The first thing that you should do to prevent violence towards others is to establish trust with the client. Without trust, future collaboration, interventions, and client outcomes cannot be accomplished to facilitate appropriate and safe behaviors. Restraints and seclusion are not indicated until others are in imminent danger because of this client's current violent behaviors and not a history of it. Lastly, sedating medications to prevent violence are also not the first things that are done. 3. You are caring for a client who has been taking illicit amphetamines and states that they continue to use this illicit drug because they suffer and feel lousy when they try to stop taking it. Which nursing diagnosis is the most appropriate for this client? Psychological dependence secondary to amphetamine use. Substance abuse secondary to amphetamine use. Addiction secondary to amphetamine use. Physical dependence secondary to amphetamine use. Answer, A. The appropriate nursing diagnosis for this client is psychological dependence secondary to amphetamine use. Psychological dependence is defined as the person's need to continue the use of the substance to avoid any unpleasant feelings and experiences that can occur when the substance is not taken. Amphetamines and hallucinogenic drugs, like LSD, are often associated with psychological dependence. Substance abuse, simply defined, is one's overindulgence of an addictive substance, which can be alcohol, prescription drugs, and/or illicit, illegal drugs. Substance abuse does not include prescribed medications, such as narcotic pain medications, that are being used for medical reasons. However, these same medications, when used after there is no longer a medical need to use them, is considered substance abuse. 4. You are the supervising nurse in a physical rehabilitation center that has the philosophy that clients have the need to cope with their disabilities and its limitations are the result of a discrepancy between the client's abilities and the limitations of the physical and social environment within which the client lives. Which model of disability is this philosophy based on? Orum's self-care model. Nagi's model. A cognitive model of disability. A biomedical model of disability. Answer, B. Nagi's model of disability model describes disabilities and its limitations are the result of a discrepancy between the client's abilities and the limitations of the physical and social environment within which the client lives. Although clients with disabilities should be assessed and have interventions related to their self-care abilities, Dorothea Orum's self-care model is not a model of disability. This model describes self-care needs and abilities as wholly compensatory, partly compensatory, and supportive educative. Cognitive models of disability focus on the importance of affected clients' ability to remain as independent as possible and ways that the empowered client can exercise their own self-determination, confidence, self-efficacy, and control. Biomedical models address pathology, impairments, and the manifestations of impairments that can be cured or lead to death. 6. Your client in crisis is detaching from self. Which psychological ego defense mechanism is this client most likely using? Displacement, sublimation, dissociation, reaction formation. Answer, C. Dissociation is the psychological ego defense mechanism occurs when the client detaches and dissociates with person or time to avoid the stress until they are ready to cope with it. Displacement transforms the target of one's anger and hostility from one person to another person or object. Displacement allows the person to ventilate and act out on their anger in a less harmful and a more socially acceptable manner. A client uses the ego defense mechanism of sublimation when they transform and replace unacceptable urges and feelings into a socially acceptable urge or feeling. A client is using reaction formation when the client acts and behaves in a manner that is completely the polar opposite of their true feelings. 7. You are the assistant director of nursing in a multiethnic and culturally diverse inner-city acute care facility. You will be chairing a committee to develop a philosophy of nursing that addresses these facility characteristics and the characteristics of the clients. Which theoretical framework would you recommend that this committee should consider when addressing multiethnicity and the culturally diverse nature of this facility for this philosophy? Gene Watson's, Martha Rogers, Nagy's theory, Madeline Leininger's theory. Answer, D. The theoretical framework that you would recommend that this committee should consider when addressing multiethnicity and the culturally diverse nature of this facility for this philosophy is Madeline Leininger's theory. Madeline Leininger's theory of transcultural nursing and her book Culture, Care, Diversity and Universality, A Theory of Nursing searches for comprehensive and holistic care data relying on social structure, worldview, and multiple factors in a culture in order to get a holistic knowledge base about care. Leininger, 2006, page 219. Gene Watson developed the human caring theory, which states that caring is the essence of nursing. Watson's theory has the four major concepts of health, nursing, society/environment, and human being. Caring consists of the following 10 nursing interventions that demonstrate genuine caring. Martha Rogers' theory is the science of unitary human beings, which is based on general systems theory without any focus on multiethnicity and cultural diversity. And lastly, Nagy's model of disability model describes disabilities and its limitations are the result of a discrepancy between the client's abilities and the limitations of the physical and social environment within which the client lives. 8. You are working as a national board for certification of hospice and palliative nurses, certified hospice and palliative care nurse who is caring for your clients in their home. Which of the following nursing diagnoses or client goal would be the most likely appropriate and expected for the vast majority of these clients? The client will accept impending death. Guilt related to past transgressions. Spiritual distress related to guilt. Pain related to end-of-life symptoms. Answer, A. The client will accept impending death as the client goal would be the most likely appropriate and expected for the vast majority of these clients. In fact, one of the primary goals of hospice and palliative care is to facilitate the client's and family members' acceptance. Other goals are the freedom for guilt, spiritual distress, and pain at the end of life. Therefore, these diagnoses are not expected. 9. You are caring for a hospice client who is at the end of life. Based on this client's signs and symptoms, the client is comatose, dehydrated, free of pain, constipated, without distress and expected to die in a day or two. Which of the following is an appropriate client outcome or an appropriate intervention for this client? The client will be free of constipation. The client will remain free of pain and distress. The administration of an antiemetic to prevent vomiting and further dehydration. The administration of an enema to correct the constipation. Answer, B. Based on this client's signs and symptoms and the fact that the client is expected to die in a day or two, the appropriate client outcome for this client is that the client will remain free of pain and distress. The client will be free of constipation, requires interventions such as an enema which are not indicated when death is imminent unless, of course, the client is adversely affected with pain and discomfort as the result of it, which is not the case with this client. Additionally, the administration of an antiemetic to prevent vomiting is not indicated because there is no evidence in this question that the client is actually vomiting. 11. You are a nurse who, as part of your role, does follow-up counseling and care for the significant others of deceased spouses for 1 year after their loss. Whose theory of grief and loss would you most likely integrate into your practice as you perform this role? Engel's theory, Kubler-Ross theory, Lewin's theory, Worden's theory. Answer, D. The theory of grief and loss would you most likely integrate into your practice as you perform this role is Worden's 4 tasks of mourning. This theory has 4 tasks that people go through after the loss of a loved one. These tasks are accepting the loss, coping with the loss, altering, modifying and changing the environment to cope with and accommodate for the absence of the lost person, and, finally, resuming one's life while still having a healthy connection with the loved one. Engel's stages of grieving include stages both prior to and after a loss, and these stages are shock and disbelief, developing awareness, restitution, resolving the loss, idealization, outcome. Kubler-Ross's stages of grieving occur prior to the death, and these stages include denial, anger, bargaining, depression, acceptance. Lewin developed theories of change, leadership and conflict, and not a theory related to grief after the loss of a loved one. 12. As the nurse in a primary care clinic, which cultural concern would you integrate into your psychological assessments of your clients? The concern related to the client's cultural reluctance to report psychological symptoms because of some possible culturally based stigma associated with psychiatric mental health disorders. Concerns revolving around the lack of financial and health insurance resources to pay for psychological care. Concerns related to the compliance with psychological treatment regimens because of the client's lack of social support systems. The concern related to the culturally based client apathy about nursing care and nursing assessments. Answer, A. The concern related to the client's cultural reluctance to report psychological symptoms because of some possible culturally based stigma associated with psychiatric mental health disorders, which is a barrier to assessment because the client fears being stigmatized and rejected when divulging psychological data, including anxiety and other symptoms. 13. You are caring for a group of clients who are adversely affected with phobias. Which form of group therapy will you most likely employ to treat these clients? Cognitive psychotherapy, behavioral psychotherapy, cognitive behavioral psychotherapy, psychoanalysis. Answer, B. Behavioral psychotherapy is particularly useful among clients who are adversely affected with phobias, substance-related disorders, and other addictive disorders. Some of the techniques that are used with behavioral therapy include operant conditioning as put forth by Skinner, aversion therapy, desensitization therapy, modeling and complementary and alternative stress management techniques. Cognitive psychotherapy is most often used to treat clients, including groups of clients, with depression, eating disorders, anxiety, and anxiety disorders to facilitate the altering of the client's attitudes and perspectives relating to stressors. Cognitive behavioral psychotherapy, which is a combination of cognitive psychotherapy and behavioral psychotherapy and also referred to as dialectical behavioral therapy, is most often used for clients affected with a personality disorder and those at risk for injury and harm to self and/or others. Psychoanalysis is not conducted by registered nurses, but, instead, by experienced psychotherapists. 14. Select the client religion that is the most pertinent to the role of the admissions coordinator of hospital who assigns the rooms and beds of clients who will be admitted. Hinduism, Buddhism, Islam, Mormonism. Answer, C. the client religion that is the most pertinent to the role of the admissions coordinator of hospital who assigns the rooms and beds of clients who will be admitted is the Islam religion, which requires that the followers face Mecca for daily prayer. Therefore, Islam clients should be placed in a room that faces the holy city of Mecca. Although most religions impact on the care of the client, only Islam is pertinent to the admissions coordinator. 15. A 76-year-old client has suddenly and abruptly started to exhibit episodic and intermittent periods of time vacillating between periods of impaired cognition and periods of mental clarity. The client reports to you that they are seeing clowns in their room. This client is dehydrated and has just begun taking an anticholinergic medication. Which of the following is the most appropriate nursing diagnosis for this client? Psychotic symptoms related to sensory overload. Psychotic symptoms related to a previously undiagnosed psychosis. Visual disturbances related to dementia. Visual disturbances related to delirium. Answer, D. Visual disturbances related to delirium is the most appropriate nursing diagnosis for this client, as based on their signs, symptoms, past history and current medical status. Delirium is characterized with a sudden and abrupt onset of episodic and intermittent periods of time vacillating between periods of impaired cognition and periods of mental clarity. Visual hallucinations are a sign of delirium, and delirium can result from a number of different causes, including dehydration and anticholinergic medications. The signs and symptoms of sensory overload do not include visual hallucinations and a sudden and abrupt onset of episodic and intermittent periods of time vacillating between periods of impaired cognition and periods of mental clarity. Instead, the signs and symptoms of sensory overload include anxiety, restlessness, sleep deprivation, fatigue, poor problem-solving and decision-making skills, poor performance, and muscular tension. Dementia has a gradual and progressive onset rather than an abrupt and sudden onset. 16. You've been conducting a weekly outpatient stress management educational series for clients in the community who are hypertensive. The best way to evaluate the effectiveness of this educational series is to collect baseline blood pressure readings prior to the beginning of this educational series, and then collect and compare blood pressure data during the series and after the series is completed. Collect baseline blood pressure readings prior to the beginning of this educational series, and then collect and compare blood pressure data after the series is completed. Ask the clients how often they use the stress management techniques that they have learned during this educational series. Use a questionnaire at the end of the series that asks the participants how they liked the class and what they learned during this educational series. Answer, A. The best way to evaluate the effectiveness of this educational series is to collect baseline blood pressure readings prior to the beginning of this educational series, and then collect and compare blood pressure data during the series and after the series is completed. This technique entails evaluating the outcomes of the education in terms of changes in the client, and it also includes formative evaluation during the series and summative evaluation at the end of the series. Collecting baseline blood pressure readings prior to the beginning of this educational series and then collecting and comparing blood pressure data after the series is completed gives us only summative evaluation. It does not provide you with formative evaluation. 17. Which of these stress management techniques employs deep focused breathing, movement and meditation? Reiki, Tai Chi, Feng Shui, Jiu-Jitsu. Answer, B. Tai Chi is a type of a mind-body exercise that deeply focuses on breathing, movement and meditation. Yoga is similar to Tai Chi in that yoga also employs a combination of breathing, movement and meditation. Reiki is done for the client when the therapist places their hands on or near the person's body to promote the client's energy field and its own natural healing processes. Feng Shui is an Eastern method of decorating using colors, items and the placement of objects in the environment to promote a harmonious relationship of man and its environment. And lastly, Jiu-Jitsu is a martial art. 18. You are a home health nurse caring for an elderly client in their home. They have children and grandchildren, but they live far from the couple, and they typically visit with your clients 1 to 2 times a year. The elderly man is beginning to show some of the signs of Alzheimer's disease dementia. The wife is also 88 years of age and has had a stroke, which has left her with left-sided weakness, but she is willing to help her husband and to maintain his safety. What kind of support should you give the wife in terms of her role caring for her husband? You should advise the couple to move closer to their children so that they can care for their father. You should teach the wife about this progressive disease and the need to promote as much independence as possible. You should teach the wife about this progressive disease and the need to do all that she can for the husband to avoid his depression and frustration. You should advise the couple to decrease their social activities in order to preserve the husband's dignity and self-esteem. Answer B. You should teach the wife about this progressive disease and the need to promote as much independence as possible. Clients with Alzheimer's disease and other disabilities, including physical disabilities, should be coached and encouraged to be as independent as possible. Moving closer to the children may not be appropriate advice, particularly if the children are unable or unwilling to care for their father. Lastly, you should advise the couple to continue their social activities and to only avoid those situations where the necessary compassion and understanding about the client and his condition are absent. 19. A therapeutic milieu is a safe environment of care that is conducive to the prevention of medical errors. A client care area that provides personal privacy and the confidentiality of medical information. A European method of design and color to promote health and wellness. The provision of a therapeutic environment of consistency to promote health. Answer D. A therapeutic milieu eliminates as many stressors from the environment as possible. The goal of this environment is to facilitate the client's coping and recovery without the need to cope with these extraneous and avoidable stressors. Some of the elements of a therapeutic milieu environment include consistency, client rules, limitations and boundaries, and client expectations, including contracts, relating to appropriate behavior,